Welcome, and Yali Madad. On behalf of the Aga Khan Health Board for the United States, we welcome you to a discussion on the COVID-19 vaccine, Light at the End of the Tunnel. My name is Dr. Ali Jawani, and I'm an interventional pulmonologist at Baylor College of Medicine in Houston, Texas, and a national member of the Aga Khan Health Board for the United States. It is my pleasure to introduce our expert panel tonight, who will discuss the new vaccines to protect us against COVID-19 and answer your questions. We have a lot to talk about, so I'll keep the intros brief. Our panelists for tonight are Dr. Tanith Lalani, who is an infectious disease physician in the Northeastern United States. Dr. Salim Virani, a professor of medicine and cardiology at Baylor College of Medicine in Houston, Texas, and chairman of the Aga Khan Health Board for the United States. Dr. Unmer Merchant, a professor of epidemiology at the University of South Carolina and a national board member of the Aga Khan Health Board for the United States. And Dr. Umed Ajani, who is a Harvard-trained physician epidemiologist. Our moderator for tonight is Marinisa Taj, an oncology nurse practitioner and doctoral candidate at Johns Hopkins University, as well as the honorary secretary of the Aga Khan Health Board for the United States. I'll go ahead and pass over to Dr. Ms. Taj.
Thank you so much, Ali. Hazrin Jamaat, good evening, and Yali Madad. Let's get started to the very important topic today, the COVID-19 vaccine, light at the end of the tunnel. Let's just do some housekeeping quickly. And before I move to the next slide right here, if you have any questions, please submit it during the webinar. We'll try to get to your questions during the webinar as well as after the webinar. If we can't get to it during, we will get to your questions after the webinar. आपको जो भी questions हो throughout the webinar, आप please अपने questions submit करें. आप एक box देखेंगे अपनी screen पे, छोटा right hand side पे, आप उसको click करके उसमें अपने questions enter करें. Thank you. Now that being said, let's get started. My first question is to Chairman Salim. Chairman Salim, what is the current status of COVID-19 pandemic in the US and our Jamaat? आप बताएंगे हमारी जमात को कि COVID-19 का क्या status है जमात में और US में?
Yeah, Ali Madad, I know we have quite a few members from the community who are attending from outside the US as well. So if we look at overall in the world right now, as of a few hours earlier, we have almost 83 million people who have contracted COVID-19. And out of those, unfortunately, we have about 1.84 million people who have died. If we look at just the US के अंदर तकरीबन 19.7 million cases अब तक हुए हैं और तकरीबन 341,000 deaths हुई हैं. Now, important चीज इसमें ये है कि when the same things keeps happening again and again, हम लोग अक्सर context lose कर देते. Just to give you some numbers, just yesterday, we had 3,700 deaths in US, the most deaths we had in our country related to COVID-19. We have more than 100,000 people in our country who are admitted to a hospital right now, and we had close to 250,000 people who were diagnosed with COVID-19. You know, हम बोलते हैं ना कि heart disease और cancer से सबसे ज़्यादा deaths होती हैं. Just to give you some perspective, इस वक्त every 23 seconds, there is a person in US who is dying because of COVID-19. Every 23 seconds, a person is dying of COVID-19. When you compare it to heart disease, every 35 to 40 seconds, there's one person who gets a heart attack, but every 1 minute, 25 seconds, there's somebody who dies of a heart attack, which is really the most common cause of death. So right now, if you look at throughout this year, COVID-19 will become the third most common cause of death. That's how many lives we have lost. The reason I give you these numbers is because this vaccine, जो आज हम vaccine के बारे में बात कर रहे हैं, this is the best way that we as a community and the entire world will get out of COVID-19. So this is one of the most important webinars that we as Health Board have done as well.
Thank you, Chairman Salim. Very important for our Jamaat. 23 seconds, one person dies of COVID-19. Please remember this. यानी कि 1 minute में हमारे पास more than 2 deaths होती हैं for COVID-19. Next question, मैं पूछूंगी Dr. Lalani से. Dr. Lalani, how many types of COVID-19 vaccines are there? currently available in the US. Can you tell us कौन सी different types of vaccines available है US में COVID-19 की?
Thank you, Marinessa, and thank you for having me. Right now in the US, there are 2 different vaccines that are available. They are the Moderna vaccine and the Pfizer vaccine. And for our UK Jamaat, there's the AstraZeneca vaccine that was also authorized for use today. There are several other vaccines that are under development, and some of these may be available in spring of 2021 if they're shown to be effective.
Thank you so much, Dr. Lalani. So as Dr. Lalani ने बताया हमें 3 किस्म की वैक्सीन्स अवेलेबल है, 2 US में जो कि मडर्ना और फाइजर की वैक्सीन्स है, और UK में आज ही अप्रूव हुआ है एस्ट्राजेनेका का वैक्सीन. Thank you, Dr. Lalani. Next question, I would ask again, Dr. Lalani, and then I would ask Dr. Ajani and Dr. Merchant to please respond in Gujarati and Farsi for all of our Jamaat. The question is, are there any differences between the 2 vaccines that are available today? Which one should I take? And how would these vaccines work and how are they given? This is a long question, so.
Thank you. So the important thing to know is that the 2 vaccines that are available, the Pfizer vaccine and Moderna, use a very similar system to work, and their effectiveness is very similar as well. So usually when we look at vaccines, like the flu vaccine, you take a small piece of the virus and you use that to immunize people and generate an immune response. With these 2 vaccines, you take the code, like the genetic code, it's kind of like the computer code, and that is what's used in the vaccine. It's surrounded by either a virus in case of the AstraZeneca virus shell, or just a lipid membrane, a fat membrane. When the vaccine goes in, your body produces the protein and then you develop the immune response to it. And because of the way it's done, the protein is developed inside your body, it generates a very strong immune response. So you get really good immunity. The main differences to note, so I would say that both are effective, and it doesn't matter which one you get, they're really effective. There's a bit of difference in the schedule. So if you go, if you get your first dose of vaccine tomorrow, for the Pfizer vaccine, they will give you a card and it will say come back in 3 weeks. So about 21, 22 days later, you'll get your second dose of the vaccine. For the Moderna vaccine, it's a little bit longer than that. So you have to wait 4 weeks to get your second dose. But apart from that, they're very similar. For the AstraZeneca vaccine, again, it's a 2-dose vaccine, but that can be spaced out to about 3 months.
Thank you so much, Dr. Lalani. Dr. Ajani and Dr. Merchant, will you please follow through? आप गुजराती में और फारसी में हमें ये थोड़ा सा brief response दे देंगे इसके बारे में?
Sure. Thank you so much for having me on this platform. સૌથી પહેલા તો આપણે વાત કરવાની કે જે બે જાતના વેક્સિન હમણાં યુએસમાં અવેલેબલ છે, એક ફાઇઝર તરફથી છે અને એક મોડર્ના કહેવાય છે. આ બંને વેક્સિન જે છે બહુ જ અસરકારક છે. બંને વેક્સિનનો કામ કરવાનો તરીકો એક જ જેવો છે, તકરીબન એક જ જેવો છે. અને આપણે કોઈ પણ વેક્સિન જોઈએ આ બંને વેક્સિનમાંથી, તો વેક્સિનમાં શું થાય છે કે આપણે વેક્સિનમાં આપણે જે વાયરસ જે છે એનો એક થોડોક એવો ભાગ કોઈ ચીઝમાં નાખીને આપણી બોડીમાં નાખે છે. એનાથી ફાયદો એ થાય છે કે આપણી બોડી એ વાયરસને કેવી રીતે ફાઇટ કરવું એના માટે એક ડિફેન્સ મેકેનિઝમ તૈયાર કરી લેવે છે. અને બંને વેક્સિન બરાબર કામ કરે છે, સારી છે અને સેફ પણ છે. ફરક બંનેમાં એ છે કે ફાઇઝર જે છે એ 2 ડોઝમાં છે અને એ 3 અઠવાડિયાના ડિફરન્સથી લગાડવામાં આવે છે. એટલે અગર તમે આજે લગાડશો તો પછી એનો બીજો ડોઝ 3 અઠવાડિયા પછી લાગશે. જે કે મોડર્ના વેક્સિન જે છે એ 3 અઠવાડિયાથી લાગે છે. એટલે એક આજે લગાડી તો પછી 3 અઠવાડિયા પછી પાછો લગાડવામાં આવે છે. આ બંને વેક્સિન હમણાં યુએસમાં અવેલેબલ છે. આપણી યુકેની જમાત માટે જે આજે વેક્સિન રિલીઝ થયો છે એસ્ટ્રાઝેનિકાનો, એનો ટાઈમિંગ થોડો ફરક છે. એમાં પણ 2 ડોઝ છે, પણ એમાં 2 ડોઝના વચમાં ડિફરન્સ થોડો લાંબો રહી શકે છે.
Thank you, Dr. Ajani. Dr. Merchant, आप फारसी में प्लीज इसको रिस्पॉन्ड करेंगे क्वेश्चन को.
Thank you very much for having me. خیلی ممنون. ما فعلا در آمریکا دو نوع واکسن داریم. یکی مدرنا هست و یکی فایزر هست. این هر دوتا خیلی شبیه به همدیگر هستند و اثر اینا هم تقریبا یکسان است. هر کدوم از اینا که به دست برسه میتونیم بگیریم. اما فرق اینه که مدرنا وکسین اگر امروز گرفتی بعد از 4 هفته دوز دوم لازم هست و اگر فایزر وکسین امروز گرفتی بعد از 3 هفته میتونیم دوز دوم بگیریم. هر دوتا دوز خیلی مهمه. خیلی ممنون.
Thank you, Dr. Merchant. Lovely to hear all these different languages, and my brain is going for a jog here. Next question is again for Dr. Lalani. Dr. Lalani, how effective is the vaccine? And very important question that seems to be very prevalent right now is how long will the immunity last after taking the vaccine?
Thank you. So the vaccines are very effective in preventing symptomatic coronavirus infection. So a coronavirus infection that causes symptoms, including severe symptoms. And so if for people who get the vaccine, their risk of getting symptomatic coronavirus infection is 95% lower than people who don't get the vaccine. So you get a very strong immune response if you get the vaccine. And so far, it looks like that has been studied. It looks like the immunity lasts for 2 months. That's what we know for sure, about 2 to 3 months. There are studies that are ongoing to see if the immunity lasts longer than that. There are studies, it's suggestive that the immunity can last for several months and maybe a year, but we really have to wait for the evidence to be sure that that is the case. Thank you.
Thank you, Dr. Lalani. Chairman Salim, आप respond करेंगे जमात के लिए इस question का उर्दू में?
जी, सो इम्पोर्टेंट चीज़ ये है कि दोनों वैक्सीन जो हैं वो 90% से ज़्यादा, ऑलमोस्ट 95% इफेक्टिव हैं, चाहे फाइजर की हो चाहे मॉडर्ना की हो। इम्पोर्टेंट चीज़ जमात के लिए यहाँ पे ये है कि इनमें से, और इन दोनों के साइड इफेक्ट्स भी वेरी सिमिलर हैं और बड़े मैनेजेबल हैं दोनों के। जमात के लिए इम्पोर्टेंट मैसेज यहाँ पे ये है कि इसमें से जो भी वैक्सीन आपके लिए अवेलेबल है, जो भी वैक्सीन आपको मिलती है, आप ले लें, वेट ना करें। ना तो आप, कुछ सवाल ऐसे भी आ रहे हैं कि एस्ट्राजेनेका की वैक्सीन आने वाली है 1-2 महीने बाद। आपको पता होगा आज यूके में एस्ट्राजेनेका की वैक्सीन अप्रूव हुई है, जो कि यूएस में अभी अप्रूव नहीं हुई है और ना अवेलेबल है। वेट करने का कोई फायदा नहीं है। इससे ज्यादा बहुत मुश्किल होगा कि दूसरी इफेक्टिव वैक्सीन आए हमारे पास। तो जो भी वैक्सीन आपको अवेलेबल है, चाहे वो मॉडर्ना की वैक्सीन हो चाहे फाइजर की वैक्सीन हो, आप उस वैक्सीन को ले लें, क्योंकि ये वैक्सीन बहुत ज्यादा इफेक्टिव है, एज लॉन्ग एज आप उसे एक ग्रुप में फॉल करते हैं कि जिन ग्रुप्स के लिए ये अप्रूव हुई है।
Thank you, Chairman Salim. Next question is again for Dr. Lalani, and I'd ask Dr. Ajani to please respond in Gujarati and Urdu. I have heard a lot about herd immunity. Will herd immunity protect me if I don't get the vaccine?
So the short answer is no. It's very important that you get the vaccine, your household members get this vaccine, and the community gets this vaccine. As Salim pointed out, natural infection is producing some herd immunity in the community, but you can see the cost of it. The number of people dying, the number of people in the hospital is astronomically high, and vaccination is the only way to combat that. And so the immune response that is generated from vaccination will protect you in case you come into contact with somebody who has a coronavirus disease. So it is very important that you get vaccinated.
Absolutely. Thank you. And Dr. Ajani.
Sure. So આપણે હર્ડ ઇમ્યુનિટીની વાત સાંભળી છે કે અગર ઘણા બધા માણસોને બીમારી લાગી જાય તો પછી આપણે બચી જાશું, અગર બધાએ બચી જશે તો આપણે પણ બચી જાશું, પણ આ વાત બરાબર નથી. આપણે આ હર્ડ ઇમ્યુનિટી માટે બધાને વેક્સિન લેવો બહુ જ જરૂરી છે. અગર આપણે વેક્સિન લેશું તો આપણે પોતાને પણ બચાવશું અને બાકી આપણે બાજુમાં જેટલા બી છે, આપણી ફેમિલી છે, આપણી જમાત છે, એને બચાવી શકશું. એ યાદ રાખવાનું છે કે આપણે પૂરી કમ્યુનિટીમાં વેક્સિન વગર પૂરી હર્ડ ઇમ્યુનિટી નહીં આવી શકે અને એના માટે બધાને વેક્સિન લેવું બહુ જ જરૂરી છે.
Thank you, Dr. Ajani. Next question. So are these vaccines safe, and what are the common side effects of these vaccines? Dr. Lalani, could you please respond to this question? And after that, Chairman Salim, And Dr. Merchant, would you please respond in Urdu and Farsi?
Thank you. So these vaccines are very safe. They now, so the studies that were done in over 70,000 people. And since approval, the Pfizer vaccine has been, about more than 2 million people in the US have been vaccinated with this vaccine. And we have data we know the follow-up for 2 months out from, getting vaccination and the people who were in the studies. And based on that, we know that this vaccine is very safe. There are some common side effects that you should know that exist with vaccines. Just like when you get the flu shot or other vaccines, you'll get very similar side effects with these vaccines as well. Both with the Moderna and the Pfizer vaccine, after you get the first dose, you will have a little bit of arm pain. So even when I got the dose, for the first day and the second day, I had mild arm pain. And if you get that, you can take a Tylenol or Motrin or something to help with the pain. After you get the second dose, your body has a very strong immune reaction. So you can feel a little bit, like fatigue or tired for a day or so, or you can have your muscles can be hurting or your joints can be hurting a little bit. Again, in most people, this side effect is mild or moderate in some cases, but you can take Tylenol or Motrin to help with it, and it recovers in a day or so. An important thing to know is when you get vaccinated, they will tell you about a website called vSafe that is monitored by the CDC. And so every day that website will send you a text message asking you if you have any symptoms related to the vaccine. And if there are any concerning symptoms, it will notify your physician as well as the CDC to take some actions. So that would be really important to sign up for as well.
Thank you. Thank you, Dr. Lalani. Chairman Salim?
जी, So what I would say is कि side effects जो इसके हैं वो बहुत mild हैं. मैंने भी पिछले हफ्ते वैक्सीन लिया था, जैसे दूसरे हमारे जो डॉक्टर्स हैं पैनल पे उन्हें भी मिला है. मोस्ट कॉमन जो साइड इफेक्ट है वो ये है कि जहाँ पे आपको इंजेक्शन लगता है वहाँ पे थोड़ा दर्द हो सकता है, जो कि यूजुअली अगर आपको दर्द हो रहा है तो आप टाइलेनॉल या मोर्फिन कुछ भी ले लें तो उससे काफ़ी कम हो जाता है. एक ये है साइड इफेक्ट. दूसरा जो है वो कुछ लोगों को थोड़ा टायर्ड फील होता है, थोड़े हेडेक्स होते हैं, मसल एक्स थोड़े हो सकते हैं, कुछ लोगों को फीवर भी होता है, मगर बहुत कम लोगों को कंपेयर टू. सबसे ज़्यादा कॉमन जो साइड इफेक्ट है यूजुअली जहाँ आर्म में आपको लगा है वहाँ 6-8 घंटे के लिए पेन होना, कुछ लोगों को 1 से 2 दिन भी हो सकता है. सेकेंड डोज के बाद और ज़्यादा लोगों को होता है. मगर इम्पॉर्टेंट चीज़ ये है जो कि डॉक्टर तहनियत ने भी इस वक्त मेंशन की कि ये सारे जो साइड इफ़ेक्ट्स हैं बहुत ज़्यादा मैनेजेबल साइड इफ़ेक्ट्स हैं. इस वजह से वैक्सीन ना लेना बहुत ज़्यादा जो है वो गैर फ़ायदेमंद बात होगी हमारे जमात के लिए कि हमें साइड इफ़ेक्ट होंगे इसलिए हम नहीं ले रहे हैं. ये सारे जो साइड इफ़ेक्ट्स हैं बड़े मैनेजेबल हैं. अगर ऐसा होता तो हमारे जमात में इतने लोगों ने ऑलरेडी ये वैक्सीन ना ली होती.
Thank you, Chairman Salim. Dr. Merchant.
خب سوال این بود که آیا این وکسین بی خطر است و موثر است؟ که خیلی بی خطر و موثر وکسین هست. این چند نقص ایمنی داره. اینه که جایی که سوزن گرفتی درد میکنه، ممکنه لرز داشته باشی، تب داشته باشی، بدن درد داشته باشی، اما این برای 1 یا 2 روز میمونه. بعد از 1 یا 2 روز این از بین میره و میتونی تایلنال یا موترین یا همچین قرصی بگیری که دردش کم بشه. دوباره ما میگیم که این اثرات خیلی خفیفه و مثل یه وکسین های دیگر هست، بیشتر از اون نیست.
Thank you, Dr. Merchant. Can I get COVID-19 from the vaccine? This is our next question. And Dr. Ajani, may I ask you to respond to this question? क्या मुझे COVID-19 हो सकता है वैक्सीन लेने से?
So the simple answer is no. हम सुनते हैं काफ़ी कि वैक्सीन लेते हैं उसके बाद हमें कुछ ना कुछ बीमारी हो सकती है और हमें कोविड भी हो सकता है. और जब हम ये सुनते हैं कि वैक्सीन बनाया इस तरह जाता है कि इसमें जो वायरस के पार्टिकल्स है या वायरस की प्रोटीन है वो उसमें है, तो आदमी सोचता है, लेकिन इस वैक्सीन से कोविड डिजीज नहीं हो सकती, क्योंकि इसके अंदर जो भी पार्टिकल डाले गए हैं वो कोविड डिजीज को प्रोड्यूस नहीं कर सकते। कई दफ़ा ऐसा भी होता है कि कोई अगर वैक्सीन लेते हैं, उससे 2-4 दिन में उनको अगर कुछ बीमारी हो गई या कोविड हो गई, तो आदमी सोचता है कि ये कोविड की वजह से, हमने जो वैक्सीन लिया उसकी वजह से ये बीमारी हुई है, जबकि ऐसा नहीं है। हमारी बॉडी को जो डिफेंस मैकेनिज्म है उसमें थोड़ा वक्त लगता है बनने में, और अगर हम उससे पहले एक्सपोज हो जाएं तो वो अलग बात है, लेकिन इस वैक्सीन की वजह से हमें कोविड नहीं हो सकता। और આપણે જે ગુજરાતી સમજે છે તેમના માટે કરી લઈએ કે આપણે ઘણી વખતે સાંભળી છે કે અગર આપણે કોવિડનો વેક્સિન લેશું તો આપણને એનાથી કોવિડ થઈ શકે છે, એવું બરાબર નથી। આ વેક્સિન લેવાથી કોઈને પણ કોવિડ ન થાય, અને જો આપણે કોઈથી સાંભળી બી કે વેક્સિન લીધું છે એના પછી 2 દિવસમાં કે 4 દિવસમાં થઈ ગયું, તો એ વેક્સિનના કારણે આ કોવિડ નથી થતું। આપણે જે વાત કરશું કે આ ડિફેન્સ મેકેનિઝમમાં થોડો ટાઈમ લાગે છે, એટલે સિમ્પલ જવાબ એ છે કે આ વેક્સિન લેવાથી આપણને કોવિડ ન થઈ શકતું, and we could not get this COVID disease from getting this vaccine.
Thank you, Dr. Ajani. May I ask you to continue responding to this question too? Will my insurance cover the cost of the vaccine? And what if I do not have insurance coverage? अगर मेरे पास insurance नहीं है, तो मैं क्या करूं, और क्या मेरा insurance इसकी cost cover करेगा?
So let me make it clear that as far as those who are in US are concerned, all insurance will cover the cost of vaccine. Basically, all preventive measures is become a part of preventive mechanism or preventive measures, and those are covered by your insurance. It doesn't matter whether you have private insurance, you have Medicare, you have Medicaid. Just like जिस तरह हमने पहले देखा था कि टेस्टिंग के मामले में था कि गवर्नमेंट ने इंतजाम किया हुआ था कि सबके लिए, जितने भी अमेरिका के अंदर मौजूद हैं उनके लिए टेस्टिंग का कॉस्ट कवर्ड था, इसी तरीके से अभी ये वैक्सीन का कॉस्ट भी कवर्ड है। Just want to make sure कि जो दूसरे ममालिक से या those who are outside from different countries, they may want to look at their own systems, what that will cover or not. But for US, those costs will be covered.
Thank you. Chairman Salim, may I ask you to add some more to this question, please?
बहुत ज़्यादा ज़रूरी है कि हम समझें कि ये जो वैक्सीन है, एटलीस्ट यूएस के अंदर गवर्नमेंट ने इसके लिए पे किया है, तो गवर्नमेंट के हिसाब से ये वैक्सीन सबके लिए फ्री है। जिनके पास इंश्योरेंस है, जिनके पास इंश्योरेंस नहीं है, उनके लिए भी अगर हम हेल्थ एंड ह्यूमन सर्विसेज के रूल्स एंड रेगुलेशंस देखें तो उसमें ये वैक्सीन कवर्ड है। इसलिए बहुत ज़रूरी है कि हम हमारे जो भी प्राइमरी केयर क्लिनिशियंस हैं, जिनके पास भी हम जाते हैं, उनको ऑफिस को कॉल करें, मालूम करें कि हमें कब मिल सकता है, जैसे ही हमारा टाइम आएगा कि हमें ये वैक्सीन मिले। दूसरी कुछ चीज़ें भी मैं इंपॉर्टेंट यहाँ पे बोलना चाह रहा था, वो ये था कि जमात शुड बी केयरफुल। कुछ मेडिकेयर के स्कैम्स भी चल रहे हैं। अगर कोई भी आपसे कहता है कि आप हमें पैसे दें, हम आपको जल्दी दे देंगे ये वैक्सीन, या ऐसी कुछ भी आपको कॉल्स आती हैं, ईमेल्स आती हैं, तो प्लीज़ आप उनको रिस्पॉन्ड ना करें, क्योंकि वन कैन एक्सपेक्ट कि जैसे ये चीज़ वैक्सीन ज़्यादा से ज़्यादा अवेलेबल होंगी, ये स्कैम्स भी बहुत ज़्यादा बढ़ जाएंगे। तो वी वांटेड टू मेक श्योर वी फ्लैग्ड इट फॉर द जमात। तीसरी एक चीज़ जो कि हमने जमात में थोड़ी बहुत देखी है कि अगर आपको कोई फार्मेसी से ये मिलता है वैक्सीन, CVS हो गया, वॉलग्रीन्स हो गया, इट इज़ परफेक्टली फाइन कि हम एक फार्मासिस्ट से लें। ज़रूरी नहीं है कि आपको सिर्फ डॉक्टर से ये लेना है। आपको कोई नर्स अगर ये दे रही है, कोई फार्मासिस्ट भी दे रहा है, दे आर ऑल फुल्ली ट्रेन्ड इन दिस। जहाँ से आपको ये वैक्सीन मिल रही है, आप वहाँ से ले लें। और मैं एक और चीज़ रिपीट करूँगा यहाँ पे, do not wait for another vaccine. Alhamdulillah, both of these vaccines that we have right now, Moderna and Pfizer, are equally effective, equally safe. Get whichever one you can get, as long as you fall in that category that is recommended to get the vaccination. इसलिए बहुत ज़रूरी है कि जहां हमें वैक्सीन मिलती है, जब हमारा टाइम आता है, हम वो वैक्सीन ले लें।
Thank you, Chairman Salim. Dr. Merchant?
خیلی مهمه که این وکسین رو بگیریم. مثلا این اصلا در آمریکا کاملا مجانیه. مثلا دولت آمریکا پول داده برای وکسین تمام مردم که تو آمریکا هستن، آیا سیتیزن هستن یا نیستن، هر کی هست. و هر کدوم وکسین که به دست ما میاد ما باید بگیریم و زنگ بزنید به پزشک شما، بپرسید از اون که کی شما بتونید بگیرید و اون رو بگیرید. و هم ممکنه که این وکسین رو از CVS یا والگرینز یا کسی فارمسی هم میتونی بگیری. مهم اینه که باید بگیری.
Thank you, Dr. Merchant. Next question is for you, Dr. Lalani. Who should be vaccinated? What about those with severe allergies, people who are immunocompromised, people or pregnant women, or lactating mothers or children? And then after Dr. Lalani, Chairman Salim and Dr. Merchant, would you please respond?
Thanks, Maranasa. So in general, the vaccine is very safe, like was said before, and people should get vaccinated. In certain groups, you have to be a little bit careful. So in terms of allergies, regular allergies are not an issue. If you have an allergy to a food product or to pets, or even if you get hives, because of allergies, that is okay. You can get the vaccine the normal way. In people who go into shock, so it's called anaphylaxis. If they have had an anaphylactic shock from another vaccine or from an IV infusion, like if you have an IV drip of something and you get an anaphylactic reaction, a severe shock-like reaction, in those patients, you still would want to vaccinate, but you would want to vaccinate in an environment where the person can be taken care of in case there are any complications. And so it's important to discuss with your provider if you have, or your doctor or whoever it is, or the nurse that's seeing you, and let them know that you've had this kind of reaction before, so that they can make sure that you are getting the vaccine in an area that they can take care of you. Anybody who gets the vaccine is going to be monitored for 15 minutes after they get the vaccine to make sure that there are no allergic reactions. In people who have severe anaphylaxis, they will be monitored for 30 minutes. So, and they will be vaccinated in a clinic or a hospital environment where, in case anything happens, they can be taken care of. For immunocompromised, in general, if you've had a cancer previously or don't have active chemotherapy going on, it's fine to get the vaccine and it'll protect you. In people who are actively going through chemotherapy or some other sort of therapy that decreases your immune response, it's important to talk to your doctor to see, when you should get this vaccine. It is recommended across all of these categories, but in certain circumstances, you might want to talk to your doctor to figure out exactly what the timing of the vaccine should be. In lactating mothers, again, it's your body is producing an immune response to a protein. And so the risk of harm to the child or the mother is very low. Whereas the antibody, the immune response that is produced will protect both the mother as well as the child. So lactating mothers, breastfeeding mothers is not an issue. In pregnant women, the vaccine has not been studied in pregnant women. And so again, the American College of Obstetrics and Gynecology does think that the benefit of getting vaccine is greater than any potential risk, because again, your body is producing an immune response to a protein. The vaccine shouldn't cross the placenta, it shouldn't cross into the child's immune system, and the antibody response that you produce, the immune response, will protect both of you. COVID-19 can be a very serious disease in a lot of these patients, immunocompromised, people who have a depressed immune system, people who are pregnant. They can have severe infection, which can lead them into the ICU or on the ventilator. So talk to your doctor and see when you can get the vaccine. In terms of children, the Pfizer vaccine was studied in children over 16 and over. And so that vaccine can be given in kids that are 16 to 18 years old. We do not have any approved vaccine for children under 16 years of age. It's being studied right now, and hopefully the vaccines should come out sometime early next year.
Thank you, Dr. Lalani. Chairman Salim?
जी, सो आई थिंक काफ़ी सारी चीज़ें हैं इसमें, मैं थोड़ा ब्रीफ रहूँगा क्योंकि डॉक्टर लालानी ने ऑलरेडी आंसर दे दिया है काफ़ी सारी चीज़ों का। अगर किसी को फूड एलर्जी है, पीनट एलर्जी है, उन्हें कोई प्रॉब्लम नहीं है ये वैक्सीन लेने का। उन लोगों को जिनको के पहले वैक्सीन लेने की वजह से सिर्फ छोटी-मोटी एलर्जी नहीं, ऐसी एलर्जी हुई है कि ब्लड प्रेशर गिर गया है, साँस लेने में तकलीफ हुई है, या उनको कोई और एलर्जीज़ हैं आईवी या आईएम मेडिकेशन से, वो भी ये वैक्सीन ले सकते हैं। उन्हें सिर्फ मॉनिटर 30 मिनट्स के लिए करना पड़ता है एज ओपोज टू 15 मिनट्स, जो कि कोई भी नॉर्मल आदमी जो वैक्सीन लेता है उसे मॉनिटर करना पड़ता है। तो आपको अगर एलर्जी है, छोटी मोटी एलर्जी में तो इनफैक्ट देयर इज नो प्रॉब्लम। अगर बहुत सिवियर एलर्जीज हुई हैं तो आप आपके डॉक्टर से बात कर सकते हैं, आप एक्सेस के थ्रू हेल्थ बोर्ड के वॉलंटियर से भी बात कर सकते हैं जो आपसे ये डिस्कस करेंगे, मगर जनरली स्पीकिंग इट्स मैनेजेबल। तो एक तो ये हमने बात की। ये वैक्सीन जो है वो प्रेग्नेंट औरतों में या वो औरतें जो कि ब्रेस्ट फीड कर रही हैं बच्चों को, उनमें स्टडी नहीं हुई हैं। ऑन दी अदर हैंड हमें पता है कि जो औरतें प्रेग्नेंट होती हैं उनको अगर कोविड-19 हो तो कोविड-19 सिवियर कोविड-19 होने का रिस्क भी ज्यादा होता है प्रेग्नेंट औरतों में। और इसके अलावा प्री टर्म बर्थ, जो कि बच्चे फुल टर्म होने से पहले बच्चों की जो बर्थ हो जाती है उसका रिस्क भी बढ़ जाता है। तो इस वक्त अगर आप अमेरिकन कॉलेज ऑफ ऑब्स्टेट्रिक्स की रिकमेंडेशन देखें तो वो कह रहे हैं कि औरतें जो कि प्रेग्नेंट हैं उनको ये वैक्सीन डेफिनेटली डिस्कस करना चाहिए अपने डॉक्टर से कि वो लें या ना लें। मोस्ट पीपल आर रेकमेंडिंग के लें औरतें। व्हाट वी वुड सजेस्ट इज कि आप ये डिस्कशन करें अपने डॉक्टर्स के साथ कि क्या आपको ये वैक्सीन लेनी चाहिए या नहीं। जनरली स्पीकिंग इट अपीयर्स कि ये वैक्सीन सेफ होगी प्रेग्नेंट औरतों के लिए और उनके लिए जो कि अपने बच्चों को ब्रेस्ट फीड कर रही हैं। बच्चों में ये वैक्सीन अभी तक अप्रूव नहीं है। काफी सारे सवाल भी इसके लिए आए हैं। जो फाइजर की वैक्सीन है वो अप्रूव्ड है उन लोगों में जिनकी एज 16 या उससे ज्यादा है। जो मॉडर्ना की वैक्सीन है वो उन लोगों में अप्रूव्ड है जिनकी उम्र 18 या उससे ज्यादा है। तो 16 से जो कम उम्र के बच्चे हैं उनमें काफी सारी स्टडीज इस वक्त चल रही हैं। इंशाल्लाह अगले 3-4 महीनों के अंदर वी शुड हैव मोर इंफॉर्मेशन अबाउट किड्स एज वेल। और जैसे वो इंफॉर्मेशन आती है इंशाल्लाह हम आपको वो इंफॉर्मेशन प्रोवाइड करेंगे।
Thank you, Chairman Salim. Dr. Merchant?
این وکسین برای هر کس که 16 سال و بالاتر از اونه میتونه بگیره. اما اگر یه الرژی معمولی داری، اگر یه الرژی معمولی داری هیچ اشکالی نداره، میتونی وکسین بگیری. اما اگر قبلا از وکسین دیگر یه ریاکشن بزرگی داشته باشی، مثلا فشار خون رفته پایین یا انافیلاکسیس به نام میگن اگر شده، پس شما باید صحبت کنی با پزشک شما، با دکتر شما. به اون صورت هم میتونی وکسین بگیری، اما در نظر دکتر باید برای نیم ساعت باشه. خانمایی که حامله هستن باید صحبت کنن با پزشکشون، ولی American College of Obstetrics and Gynecology میگه که باید وکسین گرفتن زیاد فایده داره نسبت به این که نگیرن و کووید بگیرن. خانمایی که مادرایی که شیرده هستن میتونن این وکسین رو بگیرن.
Thank you, Dr. Merchant. Dr. Lalani, will you respond to this question based on the distribution schedule? Can you tell us when will some of us get the vaccine, like healthcare workers and general public and general population? So I'll put this chart up for all of us. And then after this, Chairman Salim, आप जमात को बताएंगे थोड़ी state level nuances जो हैं उसके बारे में.
So right now, the vaccine is being given to healthcare providers. So they're considered in a category called 1A. And so those are the frontline healthcare workers that are actively seeing patients with COVID. And because the hospital system is so, overstretched right now, They want to make sure that the physicians and nurses, they have an adequate supply to be able to take care of patients. The other very high risk group for complications, people that are staying in long-term care facilities like nursing homes, those are the patients that are getting vaccinated at the moment. Like you said, there is some variation based on states. Following this, the next category will be other essential, frontline workers. And then you will get into the different age categories as well. So persons over age 75 will be prioritized. Those, from 65 to 74 years old will be prioritized after that. And then will be persons that are younger than that, but have other immunocompromising conditions. So suppose if they have diabetes, obesity, cancer, conditions that make them at higher risk of getting severe COVID, they would be up next. And then after that, it would be all other people, in the US that don't fall into these high risk categories. That's a general overview, but the slide that you put up kind of goes into some of the specifics.
Thank you, Dr. Lalani. Dr. Ajani, आप इसी को थोड़ा सा briefly हमें बताएंगे गुजराती में?
Sure. So આપણે ઘણી વખતે વાત જોઈ છે કે આપણી વારી ક્યારે આવશે. તો જ્યારે વેક્સિન આવ્યું છે તેના પછી એક ગાઈડન્સ આવી હતી કે કોને વેક્સિન પહેલા કેવી રીતે ડિસ્ટ્રીબ્યુટ થશે. એટલે સૌથી પહેલા તો જે હેલ્થ કેર ફિઝિશિયન્સ છે જે રેગ્યુલરલી પેશન્ટ્સથી ડીલ કરે છે યા કોઈ બી તરીકાના હેલ્થ કેર પ્રોફેશનમાં છે તેમને સૌથી પહેલા આપવામાં આવે છે. જરૂરત એ છે કે આપણે આ ડિઝીઝનો સ્પ્રેડ બી રોકવાનો છે અને આની વજહથી જે કોમ્પ્લિકેશન, મોર્ટેલિટી, જે મરણ થાય છે એને પણ રોકવાનું છે. તો એટલે પહેલા ફેઝમાં જે છે બધાય લોંગ ટર્મ કેર નર્સિંગ હોમ છે, ફેસિલિટીઝ છે એમાં આપવામાં આવે છે અને આપણા હેલ્થ કેરના જે પ્રોવાઈડર્સ છે એ લોકોને આપવામાં આવે છે. જ્યારે આ લોકોને મળી જાય એના પછી જે છે બીજા જે એસેન્શિયલ વર્કર છે જેમાં આપણા પોલીસ છે, ટીચર્સ છે, ફાયર ફાઇટર્સ છે, એવી રીતે ઘણા બધા એસેન્શિયલ વર્કર્સ જેને ડિફાઇન કરવામાં આવેલા છે એ અને તેમજ 75 ઉંમરથી વધારેના એ લોકોને આપવામાં આવે છે. અને તેના પછી આપણે નેક્સ્ટ સ્ટેજ પર જઈએ તો 65 થી 75 વર્ષની જે ઉંમર છે એ લોકોને આપવામાં આવશે. પણ જે 65 થી ઓછા છે પણ એને કોઈ બીમારી છે, ડાયાબિટીસ છે, હાઈ રિસ્ક છે તેને આપવામાં આવશે. અને એના પછી જે છે બાકી બધાય એટલે 16 વર્ષથી ઉપરથી લઈને 65 વર્ષના એટલે એડવાઇસ આપેલી છે કે કેવી રીતે આ વેક્સિન ડિસ્ટ્રીબ્યુટ થશે. આમાં તમે અગર જો અમેરિકામાં છો તો આ પ્રોટોકોલ ફોલો થશે. પણ આ પ્રોટોકોલ જે છે આપણો ફેડરલ ગવર્મેન્ટનો છે. આમાં દર સ્ટેટમાં પોતપોતાના હિસાબે એ લોકો થોડી ફેરફાર કરી શકે છે. એટલે એ લોકો ઉંમર ઉપર નીચે કરી શકે છે, કદાચ પ્રોફેશન ઉપર નીચે કરી શકે છે. તો ફેડરલ ગાઈડલાઇન્સ તો આ છે. તમને પોતપોતાના સ્ટેટમાં જોવું પડશે કે અગર એમાં કાંઈ ફેરફાર થયો છે તો એના હિસાબે તમારી વારી ક્યારે આવશે. પણ એક વાત જરૂરી છે, જ્યારે બી વારી આવે ત્યારે તમને લઈ લેવું જોઈએ. કોઈ પણ વેઇટ ન કરવું જોઈએ કે હું બીજા ફેઝમાં લઈશ કે બીજું વેક્સિન આવશે ત્યારે લઈશ. જ્યારે વારી આવે ત્યારે લઈ લેવું બહુ જ જરૂરી છે.
Thank you, Dr. Ajani. Chairman Salim.
जी, मैं सिर्फ इतना ऐड करूंगा कि ये सीडीसी की जनरल गाइडलाइंस हैं, मगर हर स्टेट में थोड़ी बहुत इसकी नुआंसेस हैं. जैसे मैं आपको एग्जांपल दूंगा, स्टेट ऑफ टेक्सास ने 1B में जिन लोगों की एज 65 से ज्यादा है उनको उसी कैटेगरी में 1B में ऐड कर दिया है, और 16 to 64 जिनको के मेडिकल प्रॉब्लम्स हो जैसे डायबिटीज हुआ या हार्ट डिजीज हुआ या लंग प्रॉब्लम्स हुए उनको ऑलरेडी फेज 1B में डाल दिया है, जबकि जो फ्रंटलाइन वर्कर्स हैं वो फेज 1B में नहीं है. तो इस वजह से काफी ज्यादा ये वेरी करेगा स्टेट टू स्टेट. अभी हमें पता है कि टेक्सास के स्टेट में और फ्लोरिडा के स्टेट में एक्चुअली जो सीनियर्स हैं 65 से ओवर या जो जिनकी एज 16 to 64 भी है मगर उन्हें क्रॉनिक कंडीशंस हैं उनको और ज्यादा जल्दी दी जा रही है वैक्सीन. तो बहुत ज्यादा जरूरी है कि आप नजर रखें कि आपके स्टेट में क्या रिकमेंडेशंस है. ये सीडीसी की जनरल गाइडलाइंस हैं जो कि डॉक्टर अजानी ने और डॉक्टर लालानी ने आप लोगों को बताई, मगर इंपॉर्टेंट है हम हर स्टेट के हिसाब से भी देखें. और आप देखेंगे कि हमारे जो रीजनल हेल्थ बोर्ड्स हैं वो भी इस चीज के ऊपर प्रोग्रामिंग करेंगे एम्फेसाइज करने के लिए कि किन सेगमेंट्स में अब वैक्सीन जो है वो अवेलेबल है. जैसे मुझे पता है कि आज ह्यूस्टन में और डैलस में हमारे काफी सारे सीनियर्स जो हैं जिनकी एज 65 से 70 के बीच में भी है उनको भी काफी सारे लोगों को वैक्सीन आज मिली है, जबकि दूसरे स्टेट्स में वो अवेलेबल नहीं है. फ्लोरिडा में भी जो है वो कुछ सीनियर्स को वैक्सीन मिली हैं. तो ये बड़ा डिपेंड करता है कि आप किस स्टेट में हैं. तो बहुत आप नजर रखें कि आपकी स्टेट की गाइडलाइंस क्या हैं. मैं सिर्फ इतना ऐड करूंगा ऑन टॉप ऑफ जो कि डॉक्टर लालानी और डॉक्टर अजानी ने अभी कहा था.
Thank you, Chairman Salim. हमारा next question मैं दोनों को combine करूंगी. What if I only take one vaccine in the schedule, meaning I don't take both the vaccine, और इसी के साथ will I still be protected if I take one vaccine? So if I take one of Moderna and one of Pfizer. Dr. Lalani, आप ये दोनों question को I know मैंने combine किया है, but I think the answer you would respond to in similarly for both. So Dr. Lalani, could you start out, and then I would ask Chairman Salim and Dr. Merchant to respond as well. So here's the first question.
Thank you. So it's very important that you get both doses of the vaccine. When you get one dose of the vaccine, your immune system learns how to respond to the virus a little bit. So it gives you a little bit of protection. But again, the studies that we've seen, we know that it protects you for 2 months, maybe longer. That is seen after you get both doses of the vaccine. It's important that you get both doses of the vaccine on time. So like was said before, for the Pfizer vaccine, you get it within 21 days. The Moderna vaccine, you get it 28 days. In certain situations, it might be that a second dose of the vaccine is not available, or for some reason you were unable to get the second dose of the vaccine when you had to go get it. In that case, do not panic. You can still get the second dose of the vaccine, even if it's a few days later. Just get it at your earliest convenience, because that booster dose, that's what we call it, the booster dose, really improves your immunity and will really improve the amount of protection that you have, the immune response that you have against the vaccine. In terms of when you get the vaccine, you will get a card, and the card will tell you what vaccine you got, whether you got the Pfizer or the Moderna. And so take a picture of it with your cell phone and keep the card safely. When you go back, show them the card, and they will also in their electronic medical system note like which vaccine you got the first time. The reason we don't want to mix the vaccines is because when we've studied the vaccine, all the research that was done with that particular vaccine for both doses. So we don't really know if you get a Pfizer and then the Moderna, will the side effects be any different, like the arm pain that you get, the fever that you get? We know that for sure, what the side effects are and how can you prevent and treat them if you get the right types of vaccine. Also, we don't know what the immune response is if you mix the doses. So I think it's very simple. You just keep the card, and it'll have the type of vaccine you get, and your healthcare provider should know what vaccine you got as well.
Thank you, Dr. Lalani. Dr. Ajani, I'm sorry, if you could please also respond to these two questions.
So yeah, I'll try and do that more in Urdu or Gujarati so that our other Jamaat can understand as well.
બિલકુલ.
આપણે એ ડર હોય છે કે મને કોઈ એક જ 2 ડોઝને બદલે એક જ ડોઝ લઉં તો ચાલે કે ન ચાલે. અગર એક જ વેક્સિન લઈ લઉં તો આપણે ધ્યાન રાખવાનું છે કે આ 2 ડોઝ છે, અને 2 ડોઝમાં પહેલા ડોઝથી થોડીક આપણે પ્રોટેક્શન મળે છે, અને બીજો ડોઝ જેને આપણે બૂસ્ટર ડોઝ કહીએ છીએ એનાથી આપણો સાયકલ પૂરો થાય છે. એટલે બંને ડોઝ લેવા જરૂરી છે. અગર જો આમાં ટાઈમ તમને પહેલા આપણે ડૉક્ટર લાનાલી બતાડ્યું કે 3 અઠવાડિયા કે 4 અઠવાડિયાનો ટાઈમ છે, પણ જો કદાચ આપણે ભૂલી ગયા, આગળ પાછળ થઈ ગયું તો પછી વાંધો નથી. ભલે મોડું થઈ ગયું, 2-4 દિવસ ઉપર થઈ ગયા, પણ ત્યારે બી બીજો ડોઝ લેવો જરૂરી છે, કારણ કે એનાથી આપણું પ્રોટેક્શન પૂરું થાય છે. બીજી વાત આમાં એ છે કે ઘણી વખતે માણસ સોચે કે ભાઈ એક આજે ફાઇઝરનું અવેલેબલ છે, કાલે મોડર્નાનું હોય તો હું આજે એક લઈ લઉં, કાલે બીજું લઈ લઉં, એમ થાય કે ન થાય. એમાં કોશિશ કરવી જોઈએ, ન કરવું જોઈએ, કારણ કે આ જે સ્ટડી થઈ છે એ એક જ વેક્સિન હિસાબે થઈ છે કે આપણે ફાઇઝર વેક્સિન સ્ટડી થઈ છે કે મોડર્ના થઈ છે. બંનેને મિક્સ કરવાથી એનો સાઇડ ઇફેક્ટ પર શું અસર થશે એનો આપણને ખબર નથી. એટલે આની યાદ દેરાવવા માટે જ્યારે બી તમે વેક્સિન લેશો, જ્યારે બી તમારો ટાઈમ આવશે અને વેક્સિન લેશો તો વેક્સિન દેવાવાળા તમને કાર્ડ આપશે, અને આ ખાસ તમને વિનંતી છે કે એ જે કાર્ડ જે છે એની સંભાળીને રાખવાનો. એ કાર્ડ જે છે એના પર લખેલું હશે કે તમને કયો વેક્સિન મળ્યો છે, ક્યારે મળી છે, એમાં એનો લોટ નંબર લખેલો હશે, એમાં સિરીઝ નંબર લખેલી હશે. એ તમને યાદી અપાવશે, તમને પણ યાદી અપાવશે, અને જ્યારે તમે બીજા ડોઝ પાસે જશો ત્યારે એ તમારા જે હેલ્થકેર પ્રોવાઈડર છે એને પણ યાદી અપાવશે કે તમને કયો વેક્સિન મળેલો છે, એટલે તમને એનો જ બીજો ડોઝ આપે, એમ નહીં કે એક તો બીજો થઈ જાય. થોડું આગળ પાછળ થઈ ગયું એનો વાંધો નહીં, પણ આ કાર્ડ સંભાળીને રાખવો બહુ જ જરૂરી છે, અને ધ્યાનથી રાખવું. જો તમને એમ હોય કે ખોવાઈ જશે એવું કંઈ છે તો આજકાલ બધા પાસે ફોન છે, તમે ફોન લઈ લ્યો, એનો પિક્ચર લઈ લ્યો, કોઈ હિસાબે એની યાદી અપાવી લ્યો, પણ તમને આ કાર્ડ અહીંયા એનું પિક્ચર આખું બહુ જ જરૂરી છે.
Thank you, Dr. Ajani. Dr. Merchant?
بس خیلی مهم است که 2 تا دوز بگیرن، چون با 1 دوز کافی نیست. اگر ماکسیموم اثر داشته باشیم باید 2 تا دوز بگیریم، هر 2 تا. چیز اول. دوم، اگر ما یه واکسین مدرنا گرفتیم برای دوز اول، باید دوز دوم هم باید مدرنا باشه. اگر دوز اول فایزر بود، دوز دوم هم باید فایزر باشه. چون ما نمیدونیم اگر یه مدرنا بگیریم یه فایزر بگیریم چی میشه، به اثر واکسین یا به اثرات جانبی. بنابراین خیلی مهمه که 2 تا دوز بگیریم و همون واکسین بگیریم که دوز اول گرفتیم. دوباره وقتی که ما واکسین بگیریم یک کارت به ما میدن و به اون کارت نوشته باشه که کدوم واکسین گرفتی، کی گرفتی، همچنین. پس یه عکس اون کارت بگیرید و وقتی که رفتی برای دوز دوم نشون بدید به دکترشون که اون هم تو رکوردش حتما هست، ولی شما هم باید داشته باشی که شما کدوم واکسین گرفتی.
Thank you. Thank you, Dr. Merchant. Our next question, I would ask Dr. Lalani again. Do I still need the vaccine if I have had COVID-19? And a follow-up question that we've seen a lot in the chat today is, can I get COVID-19 again after I'm vaccinated with COVID-19 vaccine? After Dr. Lalani's response, Chairman Salim and Dr. Merchant, if you could please respond too.
Thank you. Yes, it is very important that you get the vaccine, even if you've had COVID-19 before. As you know, COVID-19 has a spectrum of symptoms that it can cause. In some people, they don't even know that they're sick. Some people get really severe disease and end up in the hospital. And a lot of patients are in between that category. And so the immune response, the immunity that's developed in patients is different as well. And it can decrease with time. So it is important. The vaccine gives you very strong immunity, very strong protection. And that's why it's important that even if you've had COVID before, you get the vaccine so that you get that boost of immunity that will keep you immune for some time. And there's no need to check if you're not sure that, maybe a cold that you had was COVID or not. There's no reason to go to your physician and try to test and see if you've had COVID before. Just go ahead and get the vaccine. The other question, what was the second question?
Was, can I get COVID-19 after I'm vaccinated?
Okay. Okay, so the risk of COVID-19 after you get vaccinated goes down drastically compared to if you don't get the vaccine. As was said before, it takes a few days to develop immunity. So even after the first dose, it takes about 10 days for your immune system to start understanding, how to develop immunity. And then even after the second dose, it takes like a week or so before you get that really good immune response. So if you've had an exposure, because usually when you get exposed to the virus, you get symptoms within like 5 or 6 days. So it's possible if you had an exposure before you got vaccinated, or even in that early period after vaccination, there is a chance that you could get infections. The same way, after you've finished both doses, your risk compared to somebody who doesn't have the vaccine is 95% lower. So obviously it's not 100%. So there will be still people that might, still get the infection, but hopefully it will be a milder infection. And for example, in the studies that were done, there were close to 160 people who got infections in people who didn't get the vaccine. And the people who got vaccines, there were fewer cases, there were less than 10 cases. And so you can imagine in the healthcare system, like the people going to doctors, people going to hospitals, if you have far fewer cases, it's much easier to take care of them and to take care of the symptoms versus what is going on right now, where so many people are dying and getting the disease. So again, there is a small chance you can get COVID, but a lot fewer people will get it, and the symptoms we think are going to be milder.
Thank you, Dr. Lalani. Chairman Salim.
जी, बहुत इंपॉर्टेंट क्वेश्चन है, काफी सारे क्वेश्चन इससे रिलेटेड भी आए हैं. एज लॉन्ग एज के आपको अक्यूटली अभी कोविड-19 नहीं हो रहा है, इट इज रेकमेंडेड कि आप कोविड-19 की वैक्सीनेशन लें. वैक्सीन लेने से जो आपकी बॉडी की इम्यून रिस्पॉन्स होती है वो नेचुरल इन्फेक्शन से भी ज्यादा इफेक्टिव होती है, इसलिए बहुत जरूरी है कि वैक्सीन लें. अगर आपको कुछ स्पेसिफिक किस्म की ट्रीटमेंट मिली थी जब आपको कोविड-19 हुआ था, जो कि हम कहते हैं एंटीबॉडीज, अगर वो आपको मिली थी तो आप 90 डेज तक वेट करें कोविड-19 इन्फेक्शन के बाद. लेकिन अगर आपको वो ट्रीटमेंट नहीं मिली थी, जो कि आजकल इतनी ज्यादा यूज नहीं हो रही है मोस्ट हॉस्पिटल्स में, then you should go ahead and take the vaccine as soon as it becomes available for you. दूसरी बात ये कि जो वैक्सीन है वो 100% प्रोटेक्टिव नहीं है, 95% प्रोटेक्टिव है. इसका मतलब ये नहीं है कि अगर वैक्सीन मिल गई तो जो अगर मास्क पहनना है या डिस्टेंस दूसरों से रखना है या फैमिलीज को गैदर नहीं होना है वो खत्म हो जाएगा. वो चीजें हमें फिर भी प्रैक्टिस करनी ही पड़ेंगी. और उसके अलावा आपने जो क्वेश्चन पूछा था कि दोबारा हो सकता है, जैसे हमने कहा कि चांस है 5 to 10% के दोबारा हो सकता है, इसलिए बहुत ज़रूरी है कि हम वो सारे मेजर्स जो कि ऑलरेडी कर रहे हैं उन्हें हम कंटिन्यू करें, स्टॉप ना करें. मगर अगर आपको कोविड-19 हुआ है तो आपको दोबारा वैक्सीन लेनी चाहिए और दोबारा टेस्ट करने की ज़रूरत नहीं है वैक्सीन लेने से पहले. सिर्फ अगर आपको अक्यूटली अभी कोविड-19 है पिछले 10 से 14 दिन के अंदर तो आप ठहर जाएं. मगर एक बार आपका अक्यूट कोविड-19 ट्रीट हो गया है तो उसके बाद आप आपके प्राइमरी केयर क्लिनिशियन से बात करें ताकि आपको भी ये वैक्सीन मिल सके.
Thank you, Chairman Salim. Dr. Merchant.
अगर कोविड हम दاشتی میتونی وکسین بگیریم یا باید وکسین بگیریم. فقط اگر همین الان کووید داشته باشی باید وایسی تا مرض تموم بشه و از اون به بعد حتما باید وکسین بگیری. به خاطر اینکه و سوال این بود که این وکسین 95% اثر داره. یعنی که اگر هم وکسین گرفتی یه شانس خیلی کوچیک هست، 5% هست که بتونی کووید هم بگیری بعد از وکسین. اما اثر اون کووید کمتر میشه و خفیفتر میشه. مهمترین چیز اینه که اگر هم کووید قبلا داشته باشی باید وکسین رو بگیری.
Thank you, Dr. Merchant. This is one of our favorite questions, Chairman Salim and mine. Should I stop wearing a mask after getting the vaccine? What about physical distancing and hand washing? क्या मुझे mask पहनना, physical distancing और हाथ wash करना बंद कर देना चाहिए अगर मैं कोविड वैक्सीन ले लूं तो? डॉक्टर चरण सलीम.
देखिए, मैं इतना कहूँगा कि जितनी हमारी जमात अभी सुन रही है, आई एम श्योर आप सब ने मुझसे, ऑनसेक मेहरुनिसा से, उमेद से और दूसरों से ये मेरे ख्याल में 3 से 4 बार तो सुना होगा. ठीक है, तो अब मैं रिपीट नहीं करूंगा, हम ऑलरेडी बोल चुके हैं. देखें, बहुत ज़्यादा ज़रूरी है. वैक्सीन का मतलब ये नहीं है कि हम मास्क ना पहने, वैक्सीन का मतलब ये नहीं है कि हम फिजिकली डिस्टेंस ना करें. देखें, इस वक्त भी हमारी कम्युनिटी में बहुत ज़्यादा केसेस हैं फॉलोइंग थैंक्सगिविंग, और आपको पता है उसकी वजह क्या थी? उसकी सबसे बड़ी वजह जो फैमिली और फ्रेंड्स एक साथ जमा हुए हैं उसकी वजह से बहुत ज़्यादा केसेस हुए हैं हमारी जमात में, बहुत ज़्यादा हॉस्पिटलाइजेशंस हुई हैं, एंड अनफॉर्चुनेटली वी हैव लॉस्ट अ फ्यू जमाती मेंबर्स एज वेल. मैं आपको इससे ज़्यादा और एम्फेसाइज नहीं कर सकता हूँ. प्लीज़ 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 हमारी अर्नेस्ट रिक्वेस्ट है आपसे कि प्लीज़ आप फैमिलीज़ में गैदर ना हो, ना दोस्तों के साथ गैदर हो अभी जो दोबारा जो छुट्टियाँ आ रही हैं न्यू ईयर के लिए. और देखिए, मैं एक और चीज़ क्लैरिफाई करूँ. हम जो कहते हैं कि आप गैदर ना हो, इसका मतलब है आपका हाउस होल्ड. अगर मैं अपने घर में रह रहा हूँ और मेरे पेरेंट्स दूसरे घर में रह रहे हैं मेरे भाई या मेरी बहन के साथ, वो डिफरेंट हाउस होल्ड है। इस वक्त जो हम कह रहे हैं कि गैदर नहीं होना है, तो वो हम ये कह रहे हैं कि हाउस होल्ड अलग रहे। मैं अपने पेरेंट्स या भाई बहन उनके बच्चों से भी ना मिलूं, उसकी वजह से भी हमने बहुत ज्यादा केसेस हमारी कम्युनिटी में देखे हैं, जिस तरीके से पूरे यूएस में इस वक्त केसेस फैल रहे हैं। तो बहुत जरूरी है कि ये वैक्सीन अगर आपको मिल भी जाती है, उसके बाद भी जब तक कि पब्लिक हेल्थ अथॉरिटीज आपको नहीं कहती कि अब ओके है कि आप मिले साथ में फैमिली के, उस वक्त तक आप इसे अवॉइड करें। मास्क पहने पब्लिक में जब भी आप जाते हैं, और हाथों को अच्छी तरीके से साफ करना, हैंड हाइजीन, फिजिकल डिस्टेंसिंग, फेस मास्क, not gathering in even small family gatherings or small household gatherings or friends gathering. It is not a good idea right now. हमने नंबर्स पहले आपसे शेयर किए थे। आई होप कि हमारी जमात जो है वो इस चीज को बहुत ज्यादा ध्यान देगी इस बात के ऊपर, और कोशिश करेगी कि हम इन चीजों को अवॉइड करें, क्योंकि ऑलरेडी इसकी वजह से बहुत ज्यादा केसेस हमने देखे हैं।
थैंक यू डॉक्टर अजानी, सिंस इट्स सो इम्पोर्टेंट, आप गुजराती में इसको प्लीज कहें जमात के लिए।
શ્યોર। સો સવાલ એ છે કે આપણને વેક્સિન લાગી જાય પછી આપણને શું બાકી બધું મૂકી દેવાનું, આપણે જે હમણાં માસ્ક પહેરી છીએ, હાથ ધોઈ છીએ, તો એનો જવાબ છે કે હમણાં એ ટાઈમ નથી। તમને શરૂમાં ચેરમેન સલીમે વાત કરી કે આપણે દરમિયાન હમણાં સ્પેશિયલી યુએસમાં આ વબા કેટલી ફેલેલી છે અને એમાં કેટલા માણસો જાનથી બી હાથ ધોયા છે, અને એમાં ખાલી આપણે જનરલ પબ્લિકની વાત નથી કરી રહ્યા, આપણી જમાતમાં બી ઘણા માણસો બીમાર થયા છે અને ઘણી ડેથ્સ બી થઈ છે। એટલે એ હિસાબે ખાસ ધ્યાન રાખવાનું છે કે હમણાં વેક્સિન લાગ્યા પછી પણ આપણે જે પ્રિવેન્શન મેજર્સ છે, જેમાં આપણે હાથ ધોવાનું ચાલુ રાખીએ, આપણે માસ્ક પહેરવાનું ચાલુ રાખીએ, ફિઝિકલ ડિસ્ટન્સિંગ એ ચાલુ રાખીએ। તમને યાદ છે કે આપણી છુટ્ટીઓ હોય હતી થેન્ક્સ ગિવિંગ, એના પછી કેટલો નંબર વધી ગયા, પણ હવે હમણાં ક્રિસમસની છુટ્ટીઓ હતી, હવે ન્યૂ યર્સ આવશે। મને યકીન છે કે ઘણા બધા પ્લાન કરી રહ્યા છે કે કાલે શું કરવું છે, કાલે કઈ પાર્ટીમાં જવું છે, કાલે કોના ઘરે જવું છે। જેટલું બની શકે તેટલું તમે પોતાના ઘરમાં રહ્યો। આનો મતલબ એ નથી કે આપણી બધી મોટી ફેમિલી ભેગા થઈ જાય, આપણે 4 દિવાળીમાં આપણે જે રહેતા હોય આ 4 દિવાળીની અંદર જેટલા બી છે એ રહેવે, બીજી ફેમિલી આપણા ભાઈ બહેનો ભલે અલગ રહે છે એને પાસે બી હમણાં ન જવું, અને એ સોચી લેવાનું કે એમાં આપણી પણ ભલાઈ છે અને એમની પણ ભલાઈ છે। જ્યારે આ વેક્સિન ઇસ્તેમાલ થઈ જશે અને જ્યારે આ વબા કમ થશે, ત્યારે બધાને આપણે પબ્લિક હેલ્થ અને હેલ્થ ઓર્ગેનાઇઝેશન તરફથી ઇન્ડિકેશન મળશે કે હવે સહી છે, ત્યારે આપણે કરી। જ્યાર સુધી એ નથી આવતું, આપણે યાદ રાખવાનું આપણે બધાની પોતાની પર્સનલ રિસ્પોન્સિબિલિટી છે કે આપણે પોતાને કેમ બચાવીએ અને આપણે ભાઈ બહેનોને, આપણે ફેમિલીને અને આપણી જમાતને કેમ બચાવીએ। એટલે જરૂરી છે કે આપણે આ પ્રિવેન્શન મેજર્સ ચાલુ રાખીએ, વેક્સિન લઈ, અને જ્યાર સુધી આપણી પાસે ગાઈડન્સ ના આવે કે હવે બધી જગ્યા મળવાની ઇજાજત છે, ત્યાર સુધી આપણે પોતાને પ્રિવેન્શનમાં રાખીએ।
થેન્ક યુ ડોક્ટર અજાની। ડોક્ટર મર્ચન્ટ।
خیلی مهمه که اگر هم وکسین گرفتی ماسک رو بپوشیم، مثلا نقاب بپوشیم، باید دستارمون رو خوب بشوریم و فاصله اجتماعی رو ادامه بدیم، به خاطر اینکه این ویروس هنوز بین ما هست، ویروس از بین ما نرفته و ما میبینیم که الان هم مردم که جمع می شدن در تانکسگیوینگ که بعد از اون مقدار کیس‌ها رو رفت بالا، خیلی از جماعت کووید گرفتن و در بیمارستان هم هستن و متاسفانه از بین رفتن. بنابراین خیلی مهمه که ما همون کارهایی که می کردیم تا حالا ادامه بدیم.
थैंक यू डॉक्टर मर्चेंट। हाजरीन जमात, मैं आपको बता दूं कि हम ये वेबिनार कंटिन्यू करेंगे 1 घंटे से थोड़ा ज्यादा, इसलिए कि हमारे पास बहुत क्वेश्चन है जमात के, एंड वी वुड लाइक टू रिस्पॉन्ड टू एवरी क्वेश्चन। इफ यू वांट टू स्टे ऑन, अगर आप कंटिन्यू करना चाहते हैं, प्लीज स्टे ऑन द लाइन। वी हैव अ फ्यू मोर क्वेश्चंस एंड वी विल गेट टू योर क्वेश्चंस आल्सो। थैंक यू। Our next 2 questions are for Dr. Lalani. Dr. Lalani, or sorry, I forgot to show this very important message here about physical distancing, face covering, and washing your hands. So the next question is for Dr. Lalani. Dr. Lalani, will I test positive for COVID-19 if I get the vaccine?
No, you cannot test positive for COVID-19 if you get the vaccine. The vaccine is a small protein from the virus. It is not the virus. And so the PCR test that people do and the antigen test, the common tests that are used to diagnose an active infection of COVID-19, those tests will not be positive after you get the vaccine.
Thank you, Dr. Lalani. And our next question is, will the vaccine work against various strains identified, or the recent strain that has been identified in the UK? This question was also asked. ये question हमसे अभी Q&A में भी पूछा गया था.
Thank you. Yeah, so it's very important that this vaccine, both the vaccines, the Pfizer, the Moderna vaccine, as well as the AstraZeneca vaccine in the UK, all of them are active against this strain that has been identified. It originated in the UK, but there are other strains that have been identified, the South African strain, and then the UK strain is now in the US as well. There's evidence for that. But it is important to note that these strains, basically, they increase the infectiousness of the virus. So that means if you have COVID, then you can transmit it to more people. And so again, wearing the mask and physical distancing, all of that is key. But this variant that's been identified, it doesn't give you more serious disease. So that means it doesn't increase your risk of going to the hospital or getting on oxygen. And the vaccine looks like it is very effective against these strains as well.
Thank you. Thank you, Dr. Lalani. Our last question for the day, who should I call? Before I go there, Chairman Salim, can you please respond to Dr. Tehaniyat's responses in Urdu?
जी, क्योंकि ये सवाल काफ़ी ज़्यादा आ रहा है, काफ़ी जमात को ये सवाल है कि जो अभी यूके में जो स्ट्रेन है, साउथ अफ्रीका में भी कुछ स्ट्रेन हैं जो डॉक्टर लालानी ने सो बात की, तो क्या ये वैक्सीन उनके सामने इफेक्टिव होगा? आंसर इज, इस वक्त हमें जितना पता है उसके हिसाब से आंसर इज यस. उन स्ट्रेन्स के सामने भी ये वैक्सीन इफेक्टिव होगी. इस वजह से बहुत ज़रूरी है कि जब हम उस ग्रुप में पहुंचें जो कि प्रायोरिटी ग्रुप है हमारे स्टेट के लिए जहां हम रहते हैं, तो हम ये वैक्सीन ले लें.
थैंक यू सो मच चेयरमैन सलीम. ये क्वेश्चन है, हु शुड आई कॉल फॉर एनी क्वेश्चन और इन्फॉर्मेशन? तो मैं आपको बता दूं, आपको कोई भी क्वेश्चन हो, प्लीज आप एक्सेस को कॉल करें, हेल्थ बोर्ड आपको ये इन्फॉर्मेशन देगी. इसके अलावा मैं आपके बताना चाहूंगी, हमारा हेल्थ बोर्ड की एक वेबसाइट है, मैं आपके साथ उसको शेयर करूंगी इस वक्त, ताकि आप उस वेबसाइट के पास जाएं. और ओके, थैंक यू. सो जैसे कि आप देख रहे हैं, ये हमारी वेबसाइट है akhb.thesmileyusa.org. और आप जब वेबसाइट पे जाएंगे तो आप देखेंगे इसमें एक टैब है इधर रेड कलर का, कोविड-19 इंफॉर्मेशन. आप इसको क्लिक कीजिए. टेक्निकल डिफिकल्टीज, आई अपोलोजाइज. और बेसिकली ये कोविड-19 वैक्सीन की जो साइट है, इसमें बहुत सारी इंफॉर्मेशन है. इसमें वैक्सीन की इंफॉर्मेशन है. जो मैं आपको खास बताना चाह रही थी कि जब आप इस कोविड-19 की वेबसाइट पे जाएंगे तो आप कोविड-19 वैक्सीन का एक टैब देखेंगे. उसको टैप करने के बाद राइट हियर आप इसको, और हमारी वेबिनार्स भी इधर हैं. जो हम आज वेबिनार देख रहे हैं, इसकी रिकॉर्डिंग इस साइट पे कल अवेलेबल होगी. द रिकॉर्डिंग ऑफ टुनाइट्स वेबिनार विल बी अवेलेबल ऑन दिस साइट टुमारो. सो इफ एनी ऑफ योर फ्रेंड्स एंड फैमिली, और इफ यू लाइक टू गो अहेड एंड लिसन टू दिस, please go here, click on this website, and you will see the recording of the webinar, which will be uploaded here. There are other webinars also that are available here for you to view on different aspects of COVID-19. But let me take you back to COVID-19 vaccine website, where if you click on it, you will see information on आप 4 डिफरेंट कोविड-19 पे PSAs देखेंगे, पब्लिक सर्विस अनाउंसमेंट, जो कि इंग्लिश, गुजराती, उर्दू और दरी में है. बहुत ही शॉर्ट 1 मिनट मैसेजेस हैं. आप प्लीज इसको देखिए. की पॉइंट्स टू रिमेंबर अबाउट कोविड-19 वैक्सीन, व्हाट शुड आई एक्सपेक्ट आफ्टर गेटिंग. सो आज जो हमने सब सुना है, ये सब चीजें इंशाल्लाह रिपीट आप देख सकते हैं, इधर आपके लिए अवेलेबल है. बहुत ही इंपॉर्टेंट मैसेज अगेन इधर अवेलेबल है. वेयर अ मास्क, wash your hands, physical distancing. और अगेन आपको कोई भी क्वेश्चन है प्लीज आप कॉल करें हमें एक्सेस के थ्रू हेल्थ बोर्ड को. मैं आपके साथ फिर ये एक वेबिनार हमारा शेयर करूंगी. और अगर आपने आज 1 घंटे को हमें सुना है, our only request as all of the panelists, I request that you take these 4 messages home, that the currently available COVID-19 vaccines are safe and effective. जो COVID-19 vaccine हमारे पास available है आज United States में, Pfizer का और Moderna का, वो safe और effective है, उसको लेना बहुत जरूरी है. Secondly, to be fully effective, these vaccines need to be taken in 2 doses, 3 to 4 weeks apart. So again, हम एक वैक्सीन लेके काम नहीं छुड़ा सकते, हमें दोनों वैक्सीन लेना इक्वली इंपॉर्टेंट है. सो प्लीज ये बात ख्याल रखें, अपने आप को स्केड्यूल करें, अपना कार्ड अपने पास रखें. थर्ड पॉइंट, these vaccines do not replace the need for physical distancing, face mask, hand washing and preventive measures जो हमने बहुत आपको बताया. And as always, please avoid all in-person gathering. I'll share an example of my own personal life, and I'm sure all of you, many of you have the same thing. I have not seen my daughter or my mother in almost a year. And why? Because it's all of our social responsibility. I will repeat this. Many of you have not done that, and that is so important. ये हम सबकी social responsibility है कि हम इस बात को समझें, because one life lost is one too many, and we cannot afford that. Thank you so much. Thank you for listening to us. Chairman Salim, any other comments, please?
जी, मैं एक बहुत इम्पोर्टेंट बात हमारी जमात के लिए यहाँ बोलना चाहूँगा. देखें, हमारी सबकी ये कम्युनल रिस्पॉन्सिबिलिटी है और पर्सनल रिस्पॉन्सिबिलिटी है कि हम मिस इन्फॉर्मेशन ना फैलाएं. क्या होता है कि कोई भी गलत चीज़ फेसबुक से आ गई या एक व्हाट्सएप मैसेज आ गया, उसे फॉरवर्ड करने से पहले कि ये होता है वैक्सीन से वो होता है, आई विल रिक्वेस्ट ईच वन ऑफ यू टू थिंक नॉट ट्वाइस but 3 times whether am I doing the right thing. By me forwarding a message that is not coming from a good source, will I prevent another person not to take the vaccine who should have taken the vaccine? बड़ी earnest request है हमारी पूरी जमात से जो कि आज वेबिनार पे है कि हम सब ये रिस्पॉन्सिबिलिटी लें कि हम मिस इन्फॉर्मेशन में पार्ट ना बने, हम उन चीज़ों को फॉरवर्ड ना करें जो कि वैलिडेटेड चीज़ें नहीं हैं. हमेशा सोर्स चेक करें. ज़रा भी आपको अगर शक है तो मोस्ट इम्पॉर्टेंट चीज़ है जस्ट डिलीट दैट मैसेज एंड जस्ट मूव ऑन, बजाय इसके कि आप मिस इन्फॉर्मेशन आगे फॉरवर्ड करें. बड़ी अर्नेस्ट रिक्वेस्ट है हमारी जमात से ये.
Thank you, Chairman Salim. And as I said earlier, हमारे पास थोड़े questions हैं जो हम continue करेंगे. Jamaat, you're welcome to stay. Please continue hanging on with us here for some more questions. First question, Chairman Salim, आया है, is it okay to fly after getting the vaccine locally and internationally?
देखें, what I would say is कि वैक्सीन का ताल्लुक फ्लाइंग से इस वक्त नहीं है, ठीक है. Maybe in 6 months it will change. Right now, the recommendation is that just getting the vaccine does not mean that you can fly anywhere you want. Because remember, this is a worldwide disease right now. US में तो vaccine available है, बहुत सारी countries में अभी start भी नहीं हुई है, right? Even within US, as of this morning, about 2.7, 2.8 million people had received vaccine. This country has 330 million people. It's going to take a while. So this does not mean that you take the vaccine. कुछ ऐसे भी questions आए थे that you've gotten the first dose. Can I fly? Well, the answer is no. Use the same precautions you would otherwise for flying that you would with getting the vaccine, at least for the next 3 to 6 months is what I would suggest.
Thank you. Thank you. That was important. Another question here is it possible that second doses won't be available because of distribution issues? And is it okay अगर मैं 3 weeks के बजाय 5 weeks हो जाए मुझे लेने में, 6 weeks हो जाए, क्या मुझे पहला डोज फिर लगाना पड़ेगा? Dr. Lalani or Dr. Chairman Salim, whoever can respond to the question.
I'll take it first, then Salim can add as well. Yes, so it's important that when it's in your control, you go and schedule the visit and you get your 2 doses. Okay. There may be instances where the vaccine might not be available for a few days, or maybe there was some issue that you had because you couldn't make your appointment. In that case, don't worry. You can get the booster at a later, but it still should be your earliest convenience. You should get it as soon as possible. But if you delay it for a few days, it's okay. You don't have to restart the vaccine. The second dose gives you that booster. So think of it as a booster, and whenever you get it, you'll get that extra immune response.
Thank you. Chairman Salim.
जी बस वही कहूँगा कि दोनों डोजेस लेना बहुत ज़रूरी है. जैसे डॉक्टर लालानी ने कहा ना कि ये सेकंड डोज बूस्टर होता है. अगर आपको फाइजर की वैक्सीन लग रही है तो दूसरा डोज आपको 3 हफ्ते बाद लगेगा. अगर मॉडर्ना की है तो 4 हफ्ते बाद. जब आप फर्स्ट टाइम जाएंगे तो आपको वो कार्ड और अपॉइंटमेंट दोनों दे देंगे दूसरे डोज के लिए. और बहुत ज़रूरी है कि दूसरा डोज लें अगर हमें उससे पूरा फ़ायदा उठाना है तो. बट लेट्स से फॉर वट एवर रीजन आपका दूसरा डोज मिस हो गया, आप 21 डेज में फाइजर की वैक्सीन के लिए नहीं पहुंचे, आप मॉडर्ना की वैक्सीन के लिए 28 डेज में नहीं पहुंचे, लेट्स से कि 40 डेज हो गए. वेल द इम्पोर्टेंट थिंग इज कि जैसे ही आपको मौका मिलता है आप दूसरा डोज ले लें और आपको दोबारा पूरी वैक्सीनेशन रिपीट करने की जरूरत नहीं है. अगर आपको 40 दिन बाद जो है वो टाइम मिलता है, अगर फॉर सम रीजन मिस हो गया है, 50 दिन भी अगर हो गए हैं, आप जाएं और फौरन से अपना दूसरा डोज जितना जल्दी ले सकते हैं ले लें, मगर आपको दोबारा पूरी वैक्सीन लेने की जरूरत नहीं है.
Thank you, Chairman Salim. Dr. Ajani, may I ask you to repeat this in Gujarati, please?
Sure. So સવાલ એ હતો કે અગર જો 2 ડોઝ લેવાના જરૂરી છે પણ એક ડોઝ રહી ગયો યા મોડું થઈ ગયું તો શું કરવાનું, અને એના માટે જરૂરી છે કે બંને ડોઝ લેવા જરૂરી છે, પહેલી વાત તો એ. બીજું કે અગર જો 3 કે 4 અઠવાડિયા છે એમાં જો અગર તમે થોડું મોડું થઈ ગયું કોઈ પણ હિસાબે, જ્યાં સુધી તમે પોતાના હિસાબે ટ્રાય કરો કે તમારો જે સ્કેડ્યુલ છે એના હિસાબે લ્યો, પણ કોઈ બીજા કારણે મોડું થઈ ગયું કે 4 અઠવાડિયા જગ્યાએ 6 અઠવાડિયા થઈ ગયા તો તમને છતાંય તમને લેવાની જરૂરી છે. પાછળથી બંને ડોઝ લેવા જરૂરત નહીં પડે, ખાલી બીજો ડોઝ લેવો જરૂરી છે, કારણ કે બીજો ડોઝ લેવાથી તમારો પૂરો કોર્સ પૂરો થશે અને તમારી ઇમ્યુનિટી ડેવલપમેન્ટ પૂરી થશે. Merunis, I would like to add here also that I understand that this could be there are slightly differences in country by country. I know UK issued a new regulation this morning. They've modified their rules and regulation based on AstraZeneca as well as some other reasons. So I just want to make sure that people do check with their own people outside of US. They may want to make sure that whatever their regulations are, whatever their recommendations are, local recommendations, is something that they'll have to follow strictly.
Extremely important point. Thank you, Dr. Ajani. Thank you for noting that. My next question, Chairman Salim, can I spread this virus to others if I got vaccinated already?
देखिए इस वक्त जो हमें पता है वो ये है कि ये वैक्सीन लेने से आपका रिस्क भी कोविड-19 का कम हो जाता है, और अगर आपको कोविड-19 इसके बाद लगता भी है, क्योंकि 100% तो इफेक्टिव नहीं है, तो उसका डिजीज की सिवियरिटी भी बहुत कम हो जाती है. नाउ क्वेश्चन ये है कि क्या ये लेने की वजह से आप स्प्रेड कम करेंगे? इस वक्त हमें पता नहीं है इसका आंसर, लेकिन चांसेस आर प्रोबेबली इट विल लीड टू लोअर ट्रांसमिशन एज वेल. वो स्टडीज इस वक्त चल रही हैं बोथ फाइजर और मॉडर्ना की वैक्सीन के साथ, एंड आई डू बिलीव दैट वेरी सून वी विल हैव दोस आंसर्स, but we hope that will be the case. I don't know if Tahaniyat, you wanted to answer anything particular related to this question as well.
No, I think that you hit on all the right stuff. Right now, we know that this vaccine prevents disease, symptomatic disease, but we don't have the answer yet if there's a little bit of virus that you could not be symptomatic from, but it could still be shed, to others. And there might be people around you. There might be people who have cancer, who are on chemotherapy, elderly people who might have not mounted a good immune response. So you want to be careful that in those cases, you're not transmitting it to others. And so wear a mask, social distance, wash your hands, do all those things, even if you get the vaccine. And then, like you said, in a few months, we should have a definite answer of whether transmission is possible or not. And most likely, if it's not, then that's the time then we can listen to the public health authorities and stop doing those measures.
Dr. Lalani, to continue on, there's a question. It says, will I have to get this every year, like a flu vaccine? And if the immunity just lasts 2 to 3 months, do I have to take it multiple times other than the booster dose?
So you have to remember that this is a novel coronavirus. We did not know about this virus until January of this year. And that's why scientists are being very cautious and studying the vaccine response and only publishing the data that they know and advocating for what they know. What we know so far for a fact is that the immunity lasts for 2 or 3 months. That's published data that everybody can look at in journals. That's a fact. There are studies, and there's reason to believe scientists have like indirect proof that the immunity would last longer than this. They think that at least it's going to be several months to a year, but there's no way of knowing until you get to that point. The important thing is, a lot of these studies were started in the summer. And so we have 6 months of data on those people that were in the studies. And so that should be published soon. So a lot of these questions, I think, will be answered in the next month or so as more studies come out and we get a better understanding of this virus and the vaccine rollout taking place. When a lot of people get vaccinated, that will also change some of the picture. And so scientists are studying that closely.
Chairman Salim, आप कुछ ऐड करना चाहेंगे इसमें?
I think डॉक्टर लालानी ने काफी डिटेल में तो ये बता दिया. I think एक और चीज यहाँ पे आई थी, and maybe I would ask others to chime in as well, कि जो कैंसर पेशेंट्स हैं या किसी को ऑटो इम्यून डिसऑर्डर्स हैं, तो वो क्या करें? Well, generally the recommendation is कि कैंसर पेशेंट्स को जब कोविड होता है तो उनकी एक्चुअली बहुत सिवियर कोविड होता है और रिस्क कॉम्प्लिकेशंस का भी ज़्यादा होता है. तो आई वुड से कि अनलेस आपको अक्यूटली कीमोथेरेपी वगैरह लग रही हो, इट इज़ एक्चुअली गुड फॉर यू. अगर आपकी हिस्ट्री ऑफ कैंसर है तो आप कोविड-19 की वैक्सीन लें. उसके अलावा अगर आपके कुछ स्पेसिफिक सर्कमस्टांसेस हैं, then discuss it with your primary care clinician, or of course you can always talk to our health board as well. The same holds true for autoimmune disorders, because sometimes autoimmune disorders में वो medications भी use की जाती हैं जो कि आपका immune system उससे weak हो जाता है, इसलिए आपके लिए ज़रूरी है कि आप ये vaccine ज़रूर लें. What we don't know is कि उनकी immune response, जिनको immune disorders हो, उतनी ज़्यादा robust होती है या नहीं होती है, मगर as such कोई side effects ज़्यादा होने का अब तक जो है वो trials में नहीं देखा गया है. I don't know, Tanyat, if you wanted to take these two, the ones with cancer as well as those with autoimmune disorders.
Yeah, I totally agree with everything that you said. In general, cancer patients are no different than the other population, and they should be vaccinated. They should get both doses of the vaccine. In certain conditions, when, like you said, they're getting active chemotherapy, that might decrease their immune response. It's important to discuss with your doctor when the best time to get vaccinated is. If there are a lot of COVID cases going on in your area, and you're at serious risk because you have a cancer, to get COVID and get severe disease, then it might be better to get the vaccine as soon as possible. If you're actively undergoing chemotherapy and you might be done in a week or so, your doctor might say, delay the vaccine for a week until your immune system is back to normal and then get the vaccine. So in all cases, it's important to discuss with your doctor and not just dismiss that, you might not need the vaccine.
Thank you, Dr. Lalani. Next question, Dr. Ajani, that is being asked, and we are specifically looking for a response in Gujarati, is how soon after getting COVID-19 can I get vaccinated? अगर मुझे COVID-19 हुआ है तो उसके कितने टाइम बाद मैं वैक्सीन ले सकती हूँ?
So you said in Gujarati, so I'll try that. अगर जो तुमने COVID-19 થયું છે તો જ્યાર સુધી તમારા પાસ તમને COVID-19 ના સિમ્પટમ્સ હોય, તમને બીમારી ચાલુ રહી છે, તમને તાવ આવી રહ્યો છે, તમને બીજા સિમ્પટમ્સ છે, ત્યાર સુધી તમે ન લ્યો. જ્યારે એ ખતમ થઈ જાય છે, સિમ્પટમ્સ ખતમ થઈ જાય છે, તમે બરાબર થઈ ગયા, પછી તમે લઈ શકો છો. આમાં ખાલી એક જ વાત જે ચેરમેને પહેલા વાત કરી કે અગર જો તમને સ્પેસિફિક કોઈ ટ્રીટમેન્ટ છે, જે તમને એન્ટીબોડી ટ્રીટમેન્ટ જે હમણાં એટલી નથી મળી રહી, એ અગર તમને મળી હોય તો તમને 90 દિવસ સુધી વેઇટ કરવાની જરૂર છે. અધરવાઇઝ જેમ તમારા સિમ્પટમ્સ ખતમ થઈ જાય પછી તમે કોવિડનું વેક્સિન લઈ શકો છો. અને બીજું એક ધ્યાન રાખવાનું કે બીજો કોઈ વેક્સિન બી છે, અગર તમે બીજો કોઈ વેક્સિન લીધો હોય, ફ્લૂનો વેક્સિન છે હમણાં ચાલી રહ્યો છે, યા તમે ન્યુમોનિયાનો વેક્સિન લીધો હોય, તો એના માટે બી તમને 2 અઠવાડિયાનો ગેપ દેવો જરૂરી છે એની પહેલા કે તમે પાછો બીજો વેક્સિન લઈ શકો.
Thank you. Thank you, Dr. Ajani. Another question that we've discussed before, Chairman Salim, if you can go over the Medicare scam in English. I know you discussed it in Urdu, but there's a request if you can just clarify a little bit on that.
Yeah, I think what we have, Medicare sent out this email a few days back as well, saying that beware of these Medicare scams. If somebody's asking for your Medicare information, asking for payment, that if you pay us money, we will prioritize your vaccination. Be wary of these emails, these phone calls, and these text messages, because the vaccine is free. The US government, at least in US, I know we have Jamaat from other countries as well. In US, the vaccine is paid for by the government. So one would not need to pay out of pocket to either get the vaccine or be prioritized for the vaccine. So if you're getting any of those emails, any of those text messages or phone calls, be very careful. Do not share any personal information. And we believe that as time goes by, these scams will become more and more prevalent as well. And that is what we were trying to emphasize. So I'm glad that this question was asked again.
Thank you. Thank you, Chairman Salim. Next question, Dr. Lalani, if you can please respond to this. Do we know, since we have short-term data on these vaccines, do we know any long-term side effects of the vaccine?
So it's important to know that vaccine side effects usually take place right after you get vaccinated. Common side effects usually occur within a week of getting the vaccine, like the arm pain, the fatigue, whatever other symptoms you have. Those are the most common things that can happen in about 40 to 60 to 80% of people that get it. Uncommon side effects, for example, like rare, neural, like brain infection, complications that occur that affect the brain system or muscles or anything like that. Even those types of reactions usually occur in the first 6 weeks of getting vaccinated. So when these studies were done, they followed people for 2 months. So, and they were done in 40,000 individuals in one study and 30,000 in another. So in 70,000 people, we have enough data to know that, even rare side effects aren't that common. There were some things that were seen, like in the studies, but nothing that was concerning that was related to the vaccine. So in some cases, you might have heard that, there was Bell's palsy, like a facial paralysis that occurred in some people. But those were seen both in the vaccine arm as well as the people who didn't get the vaccine. So that's important to know, that none of even the serious side effects have been associated with the vaccine. So that's why, and as of now, over 2 million people have been vaccinated. So even if you had a rare side effect, it gives us a lot of reassurance that a lot of people have been vaccinated. And even the reactions that we've seen, for example, the anaphylaxis, the severe allergies, these are reactions that can be dealt with in the right situation. So, if these people are monitored in a clinic or a hospital, they can get the vaccine. So I would reiterate that the vaccine is really safe and that people should get it, and it's very effective in preventing COVID.
Thank you. Thank you, Dr. Lalani. I'd just remind the Jamaat, we're sorry to keep going, but we would like to answer all the questions. We have 3 to 4 more questions and we'll finish that. So please stay with us so we can answer all of your questions. Next question also, Dr. Lalani, I would ask you, the AstraZeneca vaccine is at 80% efficiency or efficacious. I heard so. So is it still effective? Like, is it as effective as Pfizer and Moderna vaccine, which are almost 95% effective?
So the important thing to know is, before these vaccines were even, before even the studies were done, the government, both the WHO as well as the FDA and other regulatory bodies, like for different countries, they have set a benchmark. They've set a criteria that says that any vaccine that is available to the public must be at least 50% effective. So all of the vaccines, you might hear that one is 90% effective, one is 70% effective. The important thing to know is that they are way more effective than not getting the vaccine. And the important thing is that even if it's 70% or 90%, if you have a lot of people in the community getting the vaccine, you protect each other. So the protective, you hear these numbers, but that's just part of the equation, part of the problem. The bigger picture is more people have to get vaccinated to keep everybody protected in the community. So I would not pay too much attention into these numbers. I would just get whatever vaccine is available and spend your energy in getting people around you, your relatives, your community to get vaccinated as well.
Thank you for that very important response. Chairman Salim, question for you. Would treatment for COVID-19 change if I were to get the vaccine after being vaccinated? For example, remdesivir, steroids, will any of those treatments change for me?
If you get COVID-19 after getting the vaccine?
If I get the vaccine for COVID-19, and if I get COVID after that, will any of those specific treatment will change?
Well, right now, I am not aware of any, again, this is an open question, and I think Tehniat can also take this question, but I am not aware that the treatment would change any. Now, when you get COVID-19, by definition, you should have good amount of antibody. So I think steroids and remdesivir will probably stay depending on how severe your disease is. As far as the antibody treatments are concerned, somebody may or may not administer that if you already have a good antibody titer. But outside of that, I think most things should stay the same in terms of treatment if you get COVID-19 after getting the vaccine. I don't know, Tehniat, if you have anything to say about the treatments, if they would change in any significant way.
No, I totally agree. Remdesivir is the standard of care that people get when they're in the hospital, and steroids as well. I think it will be important to consult with your doctor about getting any antibodies. Like you were saying that some outpatients do get antibody infusions against the virus. And that might, your doctor might say that might have an effect on your vaccine response. But again, it's very important to have that discussion with your doctor. But in general, the treatment should stay the same.
Thank you, Dr. Lalani. Chairman Salim, question for you. When will life return to normalcy, where we may not have to wear the mask and physical distance? Our favorite question.
अगर मुझे ये सवाल का बिल्कुल सही जवाब पता होता तो क्या बात थी? The short answer is I don't think anybody knows right now, but inshallah, if we get to that point of herd immunity, whereby a very large proportion of the population has received COVID-19 vaccine and overall community transmission rates have gone really, really low, at that point, life will come back to normal. I do believe, and I don't think I have a crystal ball, or for that matter, I don't know how many people do. I do believe that there will be a life, at least for a few months or a few quarters, where even after vaccination, we will be wearing masks. We will be continuing with the very good hand hygiene, which we should continue with regardless, as well as maintaining physical distancing. And once a large proportion of the population is vaccinated, at that point, slowly, life will get back to normalcy. When that will happen, I don't think I have a very good crystal ball, but inshallah, in the next 6 to 9 months, we should be seeing more and more of life coming back to normalcy, because the fact of the matter is everybody is frustrated and bored with the current life that we all have to live through. But alhamdulillah, we are all alive. And alhamdulillah, we are able to see this vaccine that was not available 9 months ago. So there's a lot of positive here to look at as well. I don't know if others on the panel would like to take this question as well, because it's an important question.
Any other responses? Dr. Ajani?
I think basically what Salim said makes perfect sense. We don't know that, but I think we have to hope for the best, but we have to be prepared no matter what. And that's what the ongoing message is, that we need to stay conscious. We cannot lower our guards, and we need to have enough vaccination within the community. And then you will, again, as Tehniat said, we'll hear different numbers, 80% or 90% or 70%. But as long as larger proportion of community can get vaccinated, it's only at that point in time that we'll start seeing some change.
Thank you so much, Dr. Ajani. Chairman Salim, do you have any last thoughts or anything that you'd like to respond to?
I think I will just mention that, this is just the beginning of a dialogue with the community. Inshallah, we will continue to have these dialogues at the regional level with various segments of our Jamaat in various vernaculars, depending on whatever the need is. So this will continue. This was just the first webinar. As more information becomes available, we will continue to have those regional webinars. We'll continue to talk to various segments. On segment side, you showed the website as well. That website will be updated, not just with information and PSAs and videos, and this presentation from today as well. But inshallah, we will also add links related to resources where you can actually get information related to vaccine for your states. Looks like within the last 24 hours, we've actually updated quite a bit of that already on the site, but that will continue to evolve. So I would highly recommend that the Jamaat, follows the Smiley Insight, the messages from each of our regions, the messaging that's coming out from each of from the leaders in each of the regions, whether that's our local council presidents, our health board chairs, social welfare board, from the QOL portfolio. Follow what's coming in a Smiley Insight, because you will always have those things listed there. And then, of course, the website we have here, as well as d.smiley, to make sure that you're getting all the information that's out there. We will make sure that any information that needs to get out gets out in a very, very timely manner for the Jamaat.
Thank you, Chairman Salim. With that said, let's all be very vigilant. As we said, there is light at the end of the tunnel. Just wanted to thank all the panelists for being here today with us. Thank you for sharing your thoughts and all your knowledge with the Jamaat. Thank you, Hazrin Jamaat, for attending this. Please continue to reach out to Access for Health Board. We are here to answer all your questions and concerns. And just pick up the phone. If you don't call us, we will not know that you need us. So please do so. Thank you so much, Yali Madad, and good night.